You can tell someone to stand up straight, but sometimes poor posture is the result of something more than laziness or poor self-esteem. It's possible the person you see slouching next to you has scoliosis, or maybe you're the person who is off kilter a bit. I'm pleased to have with us today Dr. Kelby Culpepper from Poplarville. Dr. Culpepper is the first and only doctor in Mississippi to offer a new treatment for scoliosis patients called Clear. It's an inviting alternative to back braces and spinal surgery. Good morning. It's making me very self-conscious, making me try to sit straight here. But, you know, it's a growing problem, I'm sure, in the United States, not only because of genetics, but because of the way we carry all of the stuff around with us.
Exactly. Environmental factors do play a role in scoliosis.
Mm-hmm. You're seeing it a lot with children?
In the adult population, actually. You're seeing the last statistics put it around 4.5% of the population has some type of scoliosis. However, we're looking at numbers closer to 10% of the population.
Now, you're talking scoliosis. We're talking about crooked body here.
Yes.
Is it just a misalignment of the spine?
It's a lateral deviation of the spine. So instead of you having a straight spine, the spine deviates to the left or the right. And sometimes you'll have two curves, sometimes you'll have one curvature.
Mm-hmm. Like a C or an S is the way they describe it, something like that? Okay.
Exactly.
I was amazed when I saw the before and afters. You know, of course, a lot of teenagers and preteens have back problems. But look at this. This is a 13-year-old girl here.
This is a 13-year-old patient of ours. This is her posture. She's standing in front. When we first get the patient in, we'll take a pre-picture of their posture. We'll put them in front of this posture grid, and they have no idea they're standing like this. And you'll see on the other side, this is after about 13 or 14 treatments. Her hips are coming back underneath her. She's standing a lot straighter, and this is her normal posture.
And it looks like maybe she was carrying a book bag on one side of her body, leaning.
Not necessarily the case.
Yeah, and that isn't, but just kind of what it looks like.
Lean to one side.
Yeah.
She just didn't know. The body deviates in whatever way it can to right itself.
Mm-hmm. Speaking of not knowing if you potentially have scoliosis, what are some of the signs and symptoms, other things going on in your body?
A few of the things that you'll notice with scoliosis patients, their shoulders will be unlevel, their hips will be unlevel, their hips will deviate from one side to the other. You can also have them bend over at the waist, and you'll see humping on one side of their back versus the other because of the rib rotation that you'll see with scoliosis. And some of the early signs that we see with kids with scoliosis is poor proprioception and poor balance. Mm-hmm. So some of these kids that have 4 or 5 years old have no balance whatsoever, and then you'll start to see posture alterations like the high shoulders, the hips. Those are more the ones you want to look for because they have more of a genetic tendency towards scoliosis.
What about pain? Any pain associated with this? It
varies. Pain's subjective, depends on the patient. Some of them are in a lot of pain and discomfort. Poor breathing's associated with scoliosis, increased arthritic changes, muscle imbalance, but it varies. Some are in severe pain and some are not.
Interesting. Okay. And why are there so few doctors then offering this scoliosis treatment?
It's new. We've only been around for about 6 or 7 years now. Technology's slowly getting out there. The word's slowly getting out about what we're doing. But we're seeing more and more doctors come to do this. And the certification requirements are pretty rigorous to get certified in this type of care.
Okay. And if people would like some more information about scoliosis and perhaps the treatments that you offer at your clinic in Poplarville, where can they go for information?
They can go to our website or our Facebook page, Poplarville Chiro, or they can go to Poplarville Family Chiropractic Facebook, or they can go to the Clear Institute Facebook, or website page.
Yeah, interesting. Okay, thank you. And I'm sure that's a very happy young lady now, that 13-year-old.
Oh, she's very excited.
Yeah, when she sees those pictures, I guess she thinks, wow.
Yeah, she did. She didn't realize there was such a big difference between, she didn't realize she was standing like that, and to see her standing like that and post pictures and look at that, she's pretty amazed.
Beautiful and proud.
Thank
you very much. You know, children, teens across Mississippi heading back to school, that means carrying all those textbooks and school supplies and lunches, you name it. But a report from the U.S. Consumer Product Safety Commission shows that in the last 10 years, carrying those supplies led to many back injuries, and those injuries have increased nearly 300%. Here to talk with us more about backpack safety is mom and chiropractor, Dr. Kelvie Culpepper. Good morning. And you brought along your beautiful daughter.
I did.
We brought her specifically so that we could show all of you just how much a backpack weighs, because you don't really give it thought. These kids carry around a lot of weight.
They do. I go into the schools and I've done backpack safety seminars because I have a certification in backpack safety, and we measure the kids. We weigh the kids' backpacks. So we'll weigh the child, then we'll take their backpack, we'll put on the scales, and we'll weigh their backpacks, and we'll calculate how much weight they're supposed to have and how much weight they actually have in the backpack.
What's the formula?
So the average amount of weight you should have in your backpack for your child is 10% of their body weight. Some sources will say 15, but around 10% is best. And then even then, at that point in time, when they put the backpack on and they have too much weight in their backpack, they'll lean forward. So even though your child can carry 9 pounds, because they're about 90 pounds, if they're leaning forward for it, it's still too much weight for them.
Okay, show us, go ahead and you pick up your backpack here.
So when you pick up the backpack, you want to bend your knees, you want to pull the backpack close to you, and you want to put it on.
Well, that's heavy.
It is a little heavy. One shoulder strap at a time. And the proper...
We didn't think about taking the mic off. Here, I'll go ahead and take that off while we're putting the backpack on. Didn't think about that. By the way, you want to introduce yourself?
My name's Jaylee.
I think we're stuck.
I think we are too.
That's all right. Don't worry about it.
But when she carries the backpack, when you stand and you look at your child from the side, they should be able to stand up straight. You want the shoulder straps up high. You don't want it hitting them too far below the waist. So this is about a good size for her, and it's still a little bit, looks like it's making her lean forward just a little bit, even though this says she should, for her weight, she should be able to carry this amount of books. So we'll probably take some of these books out of here.
Okay. Yeah, and the problem is, many of the school districts don't have a second set of books so that the children can leave one at home and...
No, they don't. Now, however, if your child does have scoliosis or another chronic back condition, talk to the school, talk to your doctor, see if you can work something out where the child doesn't have to carry a backpack at all. And then at other points in times, some of the schools will allow you to carry roller bags so they can carry the roller backpacks and they don't have to put the backpacks on there. So that's a better option also.
How do you know if your child's having problems with their back?
Children don't complain a whole lot. Every once in a while they'll come in and they'll say, Mom, my back hurts, and you know how we are. Oh, go play, you'll be okay. Or go take a nap, it'll make it feel better. So listen to that. When they are complaining, oh, my back hurts, I'm hurting in here, check the weight of their backs. Some of our kids are pack rats. They'll put anything in their backpacks.
Clean it out.
Yes, clean out your backpack.
Thank you. Dr. Kelvie Culpepper, I wish we had more time, but you can check out Dr. Kelvie Culpepper. She has a Facebook page and a website. All right, sounds good. And that's you're from the Poplarville area.
Thank you.
All right.